Hello everyone, I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to Ask Me, our monthly session where I answer your pressing questions about eye care. The question today says, Dr. Mattis, I recently had an eye exam and was diagnosed with cataracts in both eyes. Based on the severity, it was recommended that I have cataract surgery. What is the surgical process like to have cataracts removed, and what are some of the risks associated with not having a cataract removed? Well, cataract is a very common condition, and before I delve into the risks of cataract surgery, let us start at the beginning and first find out what is a cataract, the causes, and some of the symptoms of a cataract. A cataract is a cloudy area in the lens of your eye. And here in my model that I have, we will see the lens. This is the lens, and the lens is located inside the eye. Not to be confused with a pterygium. Lots of persons call a pterygium, which is a fleshy growth on the outside of the eye. That is not a cataract. The lens inside our eyes is a protein structure, and when that lens becomes cloudy, that is what we call a cataract. Now here we have a cloudy lens. So this is a cloudy lens. And when the lens gets cloudy, it can get cloudy in different locations of the eye, and that speaks to some of the symptoms that we can get. So here we have a cloudy lens. Here we have a much cloudier lens, and so this person would not be seen well at all. And that is where we start to get visual impairment. Okay, now, what are the main causes of a cataract? Now, as we age, the proteins in the lens of the eye naturally starts to break down, and most cataracts happen as we age. So it's really an age-related condition. Other causes include a family history of cataracts. Of course, you can be born with a cataract, and that's a congenital cataract. Diabetes can cause a cataract, especially diabetes that is poorly controlled. It can speed up cataract formation. A serious eye injury, and where serious eye injuries are concerned, you may develop a cataract long after the injury has taken place. Sometimes we have surgery for different things in the eye, and that surgery can cause the development of a cataract. Taking steroid medications, that's what we use to treat certain health conditions like arthritis and allergies and so on, and that can be a risk factor for cataract development. Radiation treatment for cancer and for other diseases are risk factors that can cause cataracts to develop. Now, what are some of the symptoms of a cataract? Now, we must remember that a cataract usually forms very slowly, and it causes a cloudy, blurred, or dim vision. It can also cause a person to become nearsighted. So, if you weren't nearsighted before, and then you suddenly start to see things that are near and not see things that are far away, that indicates the development of a cataract. The way and the changes that you see colors, they look different. Problems seeing at night, especially driving at night. There's a glare from the oncoming headlights, and that can be very disconcerting. And also glare problems in the daytime with the sunlight. Also, one might say they need brighter lights to see because everything looks so dim and dull. Or seeing halos around lights. That's also a symptom of a cataract. And frequent changes in your eyeglasses or contact lens prescription. That can be also. So many causes exist, and they all don't occur at the same time, but it can gradually get worse. How are cataracts treated? Now, presently, cataract surgery is the only way to treat a cataract and restore clear vision. But you may not need it right away, and I'll go into that a little bit more. what stage should a cataract be removed? As our question said earlier, the patient was diagnosed with cataracts in both eyes and surgery was recommended. Now, the surgery can be performed at any stage of a cataract development. There is no need to wait until the cataract is quote-unquote ripe before removing it. However, when the vision impairment starts getting in the way of your daily routine, for example, reading or driving and so on, it is time to talk about surgery. And that is going to be different for everybody. There is no one set time for everyone to have cataract surgery done. And I want to make that very, very clear. Different persons have different activities, and so the decision to remove a cataract really depends on your lifestyle. And I'll quickly tell you, I had a patient who was a nurse and she had to do night duty. And so she was having great difficulty driving at nighttime. Otherwise, she was seen fairly well, but she could not drive at night. So in her case, she was a patient who wanted or needed to have cataract surgery done. Of course, I've had patients who say, oh yes, night driving is a little bit of a bother, but they will not do too much night driving, so they want to delay it a bit. So there that's an example of everybody being different and the decision to do surgery is different. Now, what happens during cataract surgery? During surgery, the ophthalmologist removes your cloudy lens and replaces it with an intraocular lens. An intraocular lens is an artificial implant that permanently stays in your eye and is never removed. So you don't have to worry about, having to remove it after 10 years. Can I delay cataract surgery? Of course. As I stated before, it depends on how much is affecting your lifestyle. And for the vast majority of patients, cataract surgery is not urgent, and it can safely be delayed until you wish to have surgery. Delaying surgery does not cause any harm to the eye. However, the vision just gets worse over time until the cataract is removed. And so that answers my next question. What are some of the risks of not having a cataract removed? When left untreated, a cataract becomes more dense and further impairs vision. If a cataract is left untreated for too long, it becomes what is sometimes called hypermature. When this occurs, the cataract becomes more dense, more difficult to remove, and sometimes more likely to cause complications during surgery. Can someone prevent or slow down the development of a cataract? Unfortunately not. No studies have proved how to prevent or slow the development of a cataract. But several strategies may be helpful, including having regular eye examinations, especially diabetic patients and patients who are on certain medications. Eye examinations can help to detect cataracts and other eye problems at their earliest stages. If you are a smoker, stop smoking. Eating foods rich in antioxidants, which are vitamins and other nutrients found in plant-based foods, such as fruits, vegetables, legumes, and whole grains that help to prevent or slow damage to cells in the body, which are caused by free radicals. Free radicals are unstable molecules produced by the body that cause cell damage, and they cause cell damage not only in the lens of your eye, but all tissues, including your skin, and this is why we get wrinkles and so on. This is why we age from free radical damage, and that's why antioxidants are so useful. We want to maintain a healthy weight, and also protecting the eyes from UVB rays by wearing sunglasses can also lower the risk of developing a cataract and slow down the progression. Let's debunk some of the common myths about cataracts and cataract surgery. Now, myth number 1, eye drops can prevent or dissolve a cataract. That is not true. Here's a fact. There are no eye drops that can prevent, cure, or dissolve a cataract, as claimed by some products. That is entirely false. Myth number 2, cataracts are reversible. No, cataracts cannot be reversed. This is because the lens becomes naturally cloudy as part of aging, and hence the process is unavoidable. Myth number 3, a cataract can grow back. No, the cloudy lens is removed and replaced with a new artificial lens. This new lens is implanted where the cataract was, and this is the reason why a cataract cannot grow back. Myth number 4, all cataracts need to be surgically removed as early as possible. As we mentioned earlier, cataracts that cause visual impairment and affect activities of daily living should be surgically removed. Otherwise, early cataracts can be managed with a new glasses prescription. Myth number 5, cataract surgery is risky. All surgeries carry a risk, cataract surgery included. However, cataract surgery has a success rate of over 95%, and it is the most common procedure performed worldwide. Myth number 6, it takes months to recover from cataract surgery. Now, the eye patch is removed the next day, and except for a few restrictions, such as avoid pools and swimming, avoiding strenuous exercise, and so on, one can resume most activities. Myth number 7, when cataract surgery is performed, the eye is removed from the socket, surgery is performed, and then it is replaced back into your body. That is false. You are usually awake when the surgery is being performed, your eye is not removed, and some patients may be put to sleep. However, most surgeries are done with the patient awake. However, the eye is anesthetized. So, I hope this cleared up some of the myths, and certainly you understand more about what a cataract is. Thank you for watching. See you next month for our next insightful session. And remember, if you have a question, just drop them in the comment section below.